Now this video is about 15 MCQ questions from the chapter Reproductive Health and also from the topic Menstrual Cycle of the chapter Human Reproduction. And they all are previous year questions. So it will be good for you for a revision purpose and for study for NEET. Question number 1. Which one of the following is an example of hormone-releasing IUDs? Option 1, copper T. Option 2, LNG20. Option 3, copper 7. Option 4, multiload 375. Answer is LNG20. All the others are copper-releasing IUD. Number 2, match list 1 with list 2. List 1 says option A, walls. That means entry of sperm through cervix is blocked. And B option is IUDs, intrauterine devices that helps in phagocytosis of sperms within the uterus. Then C option is vasectomy. Vasectomy helps in the removal of vas deferens, not the whole vas deferens but the portion, okay. Similarly, tubectomy also helps in the removal of fallopian tube. Here also, not the whole fallopian tube, a portion of the fallopian tube only. And after that, they will stitch it also. So now here, which will be the answer key? Choose a correct answer from the options given below. What should come? So that is correct. B should come as 3. So that is also correct. Then C should come as 2. And D will come as 4. So the correct answer is option 2. Question number 3. Which of this is not an important component of initiation of parturition in humans? Option 1. Increase in estrogen and progesterone ratio. Option 2. Synthesis of prostaglandins. Option 3. Release of oxytocin. Option 4. Release of prolactin. Here the answer is what is not an important component of initiation of parturition is release of prolactin. Because release of prolactin can happen after some time also. All others are essential. Question number 4. Match list 1 with list 2. List 1A says vasectomy. So vasectomy is which among the following in list 2? It's not oral method, barrier method, surgical method. Yes, vasectomy is a surgical method. Option B is coitus interruptus. That is a natural method. Cervical caps is a barrier method. And Saheli, they are oral pills, so they are oral method. So which among the following will be the correct answer? So whatever comes, we'll mark here A, 3, B, 4, C, 2, and D, 1. So the answer is option 2. A3, B4, C2, and D1. Question number 5. Which one of the following common sexually transmitted diseases is completely curable when detected early and treated properly? Option 1, genital herpes. Option 2, gonorrhea. Option 3, hepatitis B. Option 4, HIV infection. Here, if it is detected early, only one can be treated properly, and that is gonorrhea. All others are not completely curable. 6. Given below are two statements. One is labeled as assertion A and the other is labeled as reason R. Assertion A says, amniocentesis for sex determination is one of the strategies of reproductive and child health care program. That is wrong. R is ban on amniocentesis checks increasing menace of female feticide. That is correct. In the light of the above statements, choose the correct answer from the options given below. So the assertion is false, but the reason is true, which means that option 4 is right. Question number 7. Match the list 1 and list 2. List 1, A option says non-medicated IOD. That will be Lippes loop. Copper releasing IOD. That will be Multilode 375. Hormone releasing IOD. That will be LNG20. Implants. What is remaining is implants. That will be progestogens. Now we have matched. Now we'll match the options now. A, 3, B, 1, C, 4, and D, implants, that is 2. So which will be the option that matches all the 4 in this way? A3, B1, C4, then this is the option D2. So all the options are correct in this case. So answer is option 2. Question number 8. What are the potential drawbacks in adoption of the in vitro fertilization method? Option A. High fatality risk to mother. That's not there, so that is wrong. B. Expensive instruments and reagents. That is there. C. Husband or wife necessary for being donors. That is also there. D. Less adoption of orphans. That is also there. Not available in India. That is wrong. It is available. Option F is possibility that the early embryo does not survive. Possibility is there. So the answer will be no. See the options. In all the options except option 1, A is present. A is high fatality risk to mother, which is wrong. So the answer will be obviously option 1. Question number 9. The first menstruation is called option 1 menopause, option 2 menarche, option 3 diapause, option 4 ovulation. The answer is menarche. When twins are born to a family that lives next door to you, the twins are a boy and a girl. Which of the following must be true? Option 1 says they are monozygotic twins. That is wrong. Option 2 says they are fraternal twins. That is correct. Option 3 says they were conceived through in vitro fertilization. That is wrong. Option 4 says they have 75% identical genetic content. That is also wrong. Because they are fertilized, zygote was fertilized by 2 different sperms and 2 different eggs. So the answer is option 2. Question number 11. The menstrual cycle in human females normally lasts for how many days? Option A 14 days, option B 21 days, option C 28 days, option D 35 days. The answer NCERT states is 28 days roughly. 12. The cyclic discharge of blood and cellular debris from the uterus is called option A ovulation, option B menstruation, option C fertilization, option D implantation. And the answer is option B menstruation. Question number 13. Ovulation occurs around option A day 1, option B day 7, option C day 14, option D day 21. The answer is option C day 14. Question number 14. The phase immediately after menstruation is A. Luteal phase, B. Ovulatory phase, C. Follicular phase, D. Secretory phase. And the answer is follicular phase. Why it is follicular phase? Because after menstruation, the endometrium will start regenerating, and there's also the growth of follicles. That is, primary follicle will become secondary follicle, secondary will become tertiary follicle, like that. 15. Which phase is also called proliferative phase? Option A, menstrual phase. Option B, follicular phase. Option C, luteal phase. Option D, ovulatory phase. And the answer is option B, follicular phase. Subscribe to this channel as you see the video.